Okay, there's nobody here but me, so let's go ahead and get started. We were talking about schizophrenia and whether it is genetic or not. If we look at the twin studies and the families and the adoptee studies, it looks like there is a genetic factor to schizophrenia. You cannot condition somebody to be schizophrenic. So the question is, what is the inherited structure? Is it a gene structure? Is it something else? What structures are involved in schizophrenia? Which genes are being inherited and what processes do they control? One of the things that we notice is that people who are schizophrenic have different brain structures. One of the areas that are different in people with schizophrenia is they have enlarged ventricles, the open areas of the brain. They're much larger than others, and I'm going to show you. Actually, I can show it to you right now. There you go. The guy on the left is the twin of the guy on the right. As you can see, their brains aren't the same. The ventricles in the schizophrenic individual, the individual suffering from schizophrenia, is much larger than the individual who does not have schizophrenia. So the question is it the ventricles that causes schizophrenia, or does schizophrenia cause the ventricles? That's really part of the question. You can see that there are a lot of open areas. This one is especially large. That one's fairly large. This one's large. This is much larger. All the open areas. So their brains are atrophying. So is it the atrophying of the brains that cause the problem, or is it does the schizophrenia cause the atrophying, or does the atrophying cause the schizophrenia? That's the question that most people have to deal with. Okay, wait a minute. Why isn't this working? Wait a second. My thing doesn't seem to be working. Anyway, okay. So this is one of the things that we've seen. Of course, now that we have ways of imaging live people's brains, in the old days, of course, the only thing that we had were autopsies. Now it's working. Autopsies. Now we have CAT scans and MRIs. We can look at living patients. And one of the things that we've discovered is that with somebody with schizophrenia, they have enlarged ventricles for the entire time that we see that we know that they have schizophrenia. The weird part is that the larger the ventricles, the more severe the case of schizophrenia. So the other question is it because they don't eat? Is it because they have the stress of the schizophrenia? Is that causing the problem? Is that why the ventricles are enlarging? Or is it the toxic effect of the antipsychotic drugs? That's a question that we have to ask ourselves. What is it? Is it the ventricles that are causing the problem, or is it some other problem? The more advanced the case, the greater the enlargement of the ventricles, as I said before. And strangely enough, the larger the ventricles, the poorer the response to antipsychotic drugs. Research has also shown that the lateral ventricles tend to be the most likely to be affected, and we saw that before in the picture. These are the lateral ventricles right here. That's the lateral ventricles. So the more enlarged the lateral ventricles are, the more severe the case. Discordant twin studies, where one twin has schizophrenia and the other doesn't, showed that in 75% of the cases, the hippocampus and the amygdala were smaller in the schizophrenic twin. The amygdala, of course, has to do with emotional reaction. The hippocampus has to do with memory. One of the problems that we've seen with individuals with schizophrenia is they tend to not be able to, it's not like they have dementia, it's like they do accumulate memories, they just can't recover them, is the problem. The amygdala, of course, this would be one of the negative symptoms of schizophrenia, where they lose their emotional reaction to things. Researchers speculate that the enlarged ventricles and smaller brain structures denote atrophy of the neural tissue. That's potentially because they're not using them, because something toxic is destroying the nerve cells. Looking deeper into the hippocampus, researchers have discovered that the pyramidal cells of people suffering from schizophrenia are disorganized in the sufferer as compared to the normal individual. So if we look at a normal person who is trying to remember something, if we look at an individual that's normal, we see a structure, a normal columnar structure, so that if you're trying to remember something, what did I learn over the weekend? That how many reefs make up the Great Barrier Reef that goes around Australia? And the answer is it's not just one reef, it's 2,000 different reefs that have attached themselves to each other. Another piece of information that we were talking about had to do with bat guano. Guano is the feces from the bat. Bats, as they live in caves, of course, they just continue to defecate, and it piles up and piles up higher and higher and higher. What they've discovered is that in some of these caves, these piles of bat guano are massive. They're just gigantic piles of feces. And the question was, what covers the surface of the guano, of the bat feces? And the answer is cockroaches. There's cockroaches all over the outside feeding on the bat feces, as weird as that is. So those are two pieces of information. We could investigate how people remember things. Normally we find a cue. The cue gives us a piece of information. If that information is actually in our brains, then we're able to find it because that piece of information follows a logical track in the columnar structure of the neurons in your hippocampus, so that you can retrieve the information. However, somebody who's schizophrenic, if you've ever talked to somebody that's schizophrenic, a lot of times they're talking about you'll start talking about carburetors in a 57 Chevy, and all of a sudden they're talking about oranges on Mount Everest, or they're talking about what color the moon is when it first comes up. You know, really odd things. One thing doesn't have anything to do with the other. They have tied this information to a piece of information that has nothing at all to do with carburetors in 57 Chevys, and the reason is because instead of having a columnar structure to their hippocampi, to the neurons in their hippocampus, their structure is very disorganized. I'm going to show you a picture of what I'm talking about in just a minute. The degree of disorganization relates directly to the severity of the disorder. So the more disorganized the brain, neurons, the pyramidal cells. As you can see, these are the pyramidal cells. This is what it looks like in a normal brain. Everything is relatively columnar so that you can pick up pieces of information. As you can see, the pyramidal cells in a person with schizophrenia, as you can see, they're just all over the place, and they're just pointing in all kinds of strange directions. And because of that, of course, they can't retrieve information like you and I can. Machan and her colleagues speculate that this derangement in the hippocampal pyramidal cells occurs due to the maternal exposure to the influenza virus during the second trimester of pregnancy. So there are several different theories as to where schizophrenia comes from. Potentially it comes from a lot of different sources. One of them is that you have a genetic proclivity for schizophrenia. And if you do have a genetic proclivity for schizophrenia, on the same gene is the gene for autism, the gene for depression, the gene for bipolar disorder, and strangely enough, the gene for ADHD. And if you think of all 5 of those problems, one kind of follows the other. Not like you would have one, then you'd have the other, then you'd develop the other, then you would develop the other one. That's not the way it works. Normally, if you have the proclivity for ADHD, you keep the ADHD gene, you're never going to become schizophrenic, you're not going to become have bipolar disorder, you're not going to be depressed. You just have this proclivity and it manifests itself in a select way, either with autism, schizophrenia, bipolar disorder, depression, or with ADHD. However, there's another theory as to where this comes from, or where schizophrenia comes from. One of them is that if your mother develops flu during her second trimester, then potentially you will, the child will become schizophrenic. And the reason is because it deranges the hippocampal pyramidal cells. The influenza does. Now, interestingly enough, sometimes one of the other things that we know about schizophrenia is that people that smoke marijuana are more likely to develop schizophrenia. Not that the marijuana causes schizophrenia, but that the marijuana triggers the schizophrenia in someone who has a proclivity for the schizophrenia. There seems to need to be a cerebral insult that takes place, a blow to the head, the marijuana, individuals who smoke crack. These individuals will have episodes of schizophrenia, of psychosis. Actually, they'll have episodes of psychosis. Potentially, this can become permanent. So it has to do with insults to the brain. And one of the potential insults to the brain is the flu. Now, this is really kind of interesting because if you think about it, the flu season started in October and it will end probably in January, by the January, beginning of February. So if that's the second trimester, when would the baby be born who has a proclivity for schizophrenia? And the answer is in the spring. So if you have an individual that is born in March, April, May, potentially June, but March, April, May, if they're born in that era, then they would have gone through the second trimester during the flu season. Strangely enough, if we look at all the people that are schizophrenic, the ones that are the most affected are the individuals who are born in the spring, March, April, and May. Looking at blood flow, I was born in October. Okay, so just because you're born in March or April or May doesn't mean that you're going to be schizophrenic. It just means that you have a greater likelihood of being schizophrenic. If your mother didn't catch the flu during her second trimester, you're good to go. So I wouldn't even worry about it, especially if you're born in June, July, August, September, October, November, December, January, February, you're probably okay. Because the flu season hadn't started yet, or during the second trimester anyway. So if she catches it in the third trimester, your brain's already developed. If she catches the flu in the first trimester, your brain isn't to the point where you're building pyramidal cells, so you're okay. Looking at blood flow in the brain during resting state, researchers have discovered that in the brain of a schizophrenia sufferer, the left hemisphere is more active than the right hemisphere in the frontal lobe. PET scans indicate that people suffering from schizophrenia have less metabolic activity in the frontal lobe, and we're going to see a picture right now. There you go. This is an individual with schizophrenia. As you can see, not much going on in the frontal lobe. That one, the individual is thinking about something. We've got the same thing going on here. And we have the same thing going on here. This is a schizophrenic twin, and as you can see, there's less going on in their frontal lobe than we we have in the individual that is not schizophrenic. Much of the proof of dopamine is the neurotransmitter that causes the symptoms of schizophrenia comes from pharmacological studies. In other words, we have given individuals medication that blocks the D2 receptor site, and it has not cured their schizophrenia, but it has lessened the effects of their schizophrenia. So if we block the D2 receptor site with pharmaceuticals, of course, one of the things that we have noticed is that the individual will be less schizophrenic. Now, one of the interesting things about people who are schizophrenic is that a lot of them, in order to dissipate their symptoms, they will be chain smokers. One of the interesting things about tobacco is that it increases the amount of dopamine in your brain. With that increase of the amount of dopamine, it blocks the D2 receptor site because it induces all this dopamine to block the D2 receptor sites. So this is one of the kind of interesting things that you see about individuals suffering from schizophrenia. They will be chain smokers, smoking a lot of tobacco. Tens of thousands of schizophrenia sufferers were able to leave psychiatric hospitals when chlorpromazine was discovered. Chlorpromazine and the phenothiazines block D2 receptor sites. For this reason, we assumed that was it. But of course, we found other reasons and other causes for schizophrenia other than the dopamine explanation. There's lots of different types. Some people, of course, do not respond to dopaminergic pharmaceuticals. They don't work on these select individuals, and these are the individuals that have the worst symptoms. The phenothiazines won't work on these select individuals. Due to the pharmacological evidence, it seems that the effectiveness of the antipsychotic agents is directly related to the magnitude of postsynaptic receptor blockade of dopamine sites. And of course, this is due to the fact that the pharmaceuticals do block these sites, or at least they fill these sites with exogenous dopamine. And because of that, we assume that is one of the ways that we can cure somebody who is suffering from schizophrenia. If it works, some people it doesn't work on. Parkinson's disease is caused by the degeneration of the nerve cells in the substantia nigra, which contain dopamine. As these cells die, the Parkinson's gets worse and worse and worse. And of course, if you want to see somebody with Parkinson's disease, I don't think Michael J. Fox is doing anything as far as movies are concerned, but you can look at him on YouTube. He has a difficult time controlling his hands. He has a difficult time. He has facial tics. He has a difficult time walking, and that's what Parkinson's disease is. When a patient is given too much L-DOPA to compensate for the loss of dopamine, they develop schizophrenic type symptoms. Some schizophrenic patients will develop Parkinsonian type symptoms if only medicated with if over-medicated with phenothiazines. So we know that this happens if somebody has Parkinson's disease and we give them too much L-DOPA, put too much, give them too much dopamine. Of course, it will cause them to have schizophrenic-like symptoms. If somebody with schizophrenia is given too much phenothiazines, then they start walking around like they have Parkinson's disease. I don't know if you've ever watched anybody that has Parkinson's disease. They have a hard time moving their feet. They have to shuffle their feet. They also have hand tremors and whatnot. And of course, this is something that we see if we over-medicate somebody with schizophrenia, then they get the hand tremors and they have a difficult time walking. Some schizophrenia sufferers treated with dopamine inhibitors do not respond, as I said before. Recently, there has been a new generation of antipsychotics that have been developed that do not affect just dopamine levels, and they do work. In other words, we can block the dopamine. If that isn't working, then we can give them a pharmaceutical that blocks something else. And in this case, it's serotonin is the other thing that we're blocking. These are known as atypical drugs, atypical antipsychotics. Clozapine is an atypical antipsychotic drug that not only blocks dopamine receptors, but serotonin receptors as well. Clozapine actually seems to increase dopamine reception in the frontal cortex, and that's okay because obviously schizophrenia isn't caused by too much dopamine in your frontal cortex. It has something to do with the back portion of your brain, not the front portion of your brain. One theory about the development of schizophrenia is that select chemicals build up or are created in the brain that cause the psychosis. These substances are referred to as psychotogens, which literally means brain monsters, psychotogens. One theory is that in addition to a methyl group to the brain chemistry can cause the conversion of normal compounds known as hallucinogenic agents. This is known as the transmethylation hypothesis, methyl crossing process, transmethylation process. This is another theory as to why schizophrenia is so prevalent. As we said before, 1 to 2% of any population around the world is schizophrenic or is suffering from schizophrenia. The psychobiological model of schizophrenia emphasizes that there may be several factors interacting to cause schizophrenia. Each life phase of brain development provides potential triggers to the development of schizophrenia. And of course, this is one of the things that we see. Normally, we don't see schizophrenia in anyone before puberty. After puberty, of course, all bets are off. The brain becomes more hardwired after that. There's not a lot of change that will take place in the brain. And because of that, we very rarely see children with schizophrenia. However, if we do have a child with schizophrenia, one of the outcomes will be that they will have a more severe form of schizophrenia, and they will also be less likely to respond to the dopaminergic antipsychotic medications, which is kind of unfortunate. They tend to have an extremely severe case of schizophrenia. The younger you develop it, the more severe the case of schizophrenia. And this is one of the reasons why, this is one of the reasons that we've talked about marijuana being a dangerous drug. It is some kind of, it is a form of insult to the brain, and because of that, if somebody has a proclivity for schizophrenia, they will develop schizophrenia. Crystal meth will do the same thing. So if we are snorting cocaine, any of the amphetamines will do exactly the same thing. Ecstasy can do the same thing. LSD can do the same thing, can kick you into a psychotic episode that you never recover from, as sad as all of that is. People genetically predisposed with brain abnormalities may or may not experience the proper triggers in the correct sequence to create the conditions for schizophrenia. And this has to do with the biological aspect. You have to have the fluid at select time, you need to start smoking pot at the right time, and that will trigger your schizophrenia. Viral illnesses such as influenza and inoculations may be part of the trigger. So individuals who have never had the flu, potentially, they are less likely to develop schizophrenia. But of course, we all have rhinoviruses Children have colds. These are all viruses. These are all viruses that potentially get into your brain. The stress of urban life as compared to rural life shows that more people per capita have schizophrenia in urban settings compared to rural settings. So that may have something to do with the trigger as well, the stress of living in the city. Thus, schizophrenia may emerge when the combination of life stressors are added to the neurological triggers and the genetic brain abnormalities. And like I said before, there's lots of different reasons for people developing schizophrenia. It's fairly set. 1 to 2% of the people in any country will be schizophrenic. As I said before, autism is on the same gene as schizophrenia. It's also on the same gene as depression, ADHD, and bipolar disorder. Autism, and this is really an interesting question because the basic question is schizophrenia more severe than autism? If we look at it on a continuum with the least severe form of mental illness being ADHD, what is the most severe? Is it autism or is it schizophrenia? Schizophrenia, people suffering from schizophrenia will interact with other individuals. People with severe autism will not interact with other individuals. So which is the more severe, autism or schizophrenia? I personally would say that autism is more severe than schizophrenia. But of course, I'm not the final answer on this. Autism is a lifelong developmental disorder. It's characterized by impaired social interaction where the individual does not want to interact with anyone. They are afraid of other people. They can get used to other people depending on how severe it is. Of course, autism is a spectrum as well. In the old days, when I first started in psychology, I learned that 70% of all people suffering from autism would never develop language skills. Now, of course, the more severe cases of autism, they do not develop language skills. They have a very difficult time interacting with anyone. They certainly will not be able to interact with strangers. But of course, it's a spectrum. So there are severe cases, and then there are cases that you can barely tell that the individual has a problem at all. So the impaired social interaction is one of the characteristics of autism spectrum disorder. Impaired language, because since they don't look at people's faces, they aren't able to watch their mouths move, and for that reason they have impaired language skills. There's a narrow range of interests and activities. A lot of times these people are focused on select things. If you remember the movie Rain Man, he wanted to watch Judge Judy, I think, or Judge Wapner. It's kind of an old movie. Anyway, he had to watch Judge Wapner at a certain time. Everything had to happen at a certain time. And he counted things. He was a counter. They may perseverate. This is a word from persevere. They may nod their head on a continual basis, and they will persevere at nodding their head. They may have ritualized finger movements. A lot of times they will rock back and forth. Usually it's from side to side. Sometimes it's forward. They like movement that is regulated, that's ritualized, and of course, as long as they're in their ritualized behavior, a lot of times they're okay. As soon as you get them out of that ritualized behavior or try to force them out of their ritualized behavior, now we got a problem. They have difficulty judging other people's thoughts and feelings, and this is mainly because they don't look at other people, so they can't read other people. Autism seems to have strong heritability. It occurs in 1 to 2 children per 1,000. It is far more common in males than it is in females. A study by Rodier in 2000 demonstrated a common abnormal allele on the Hox gene and on this of the 7th chromosome reduced the, if we look at the corpus callosum of children suffering from autism, it's smaller than a child it does not have autism. There's a reduced size in the select cerebellar regions. This has to do with movement. Normally has to do with movement. As you can see, this is the corpus callosum of a child with autism, and this is one who does not have autism, or a normal child. While periods of unhappiness affect everyone from time to time, prolonged chronic depression occurs most often in people over 40. Geez, that must mean me, I'm 70. Women 2 to 3 times more frequently than men, depending on the area. And as we're going to find out, it probably has something to do with self-medication. Depression is not sadness, but is characterized by unhappy moods, loss of interest, energy, and appetite, difficulty in concentration, restless agitation. We were talking about this in counseling class. One of the difference between sadness and depression, somebody who's depressed rarely cries. The reason is because they can't show emotions. It's almost like they have no emotions whatsoever. They are so depressed that their face looks, the muscles in their face look dead, as if they had been decapitated, which thank God you've never seen anybody that's been decapitated. But they lose their muscle tension in their faces, and this is the way they look. They have a blank look on their faces. Depression may not be triggered by any apparent stress. Without treatment, it may last for months. Depression is a severe form of sadness. Depression may afflict 13 to 20% of the population at any one time. Usually it's in the wintertime, as weird as that sounds, and that's mainly because the sun, we don't get white light in the wintertime. We get yellow light. White light has something to do with depression. Seasonal affective disorder is a disorder where individuals develop depression because they're not getting enough sunlight. Of course, we're only getting 6 to 8 hours of sunlight. The farther north you go, of course, the darker it is, the less sunlight that you get, the more limited your activity can possibly be because you tend to stay inside when it's dark. So individuals living farther north, probably than this, I would imagine, have a problem with seasonal affective disorder. Bipolar disorder is diagnosed when someone who suffers from depression also displays episodes of excessively expansive moods, which include sustained overactivity, talkativeness, increased energy, and strange grandiosity. Depression may lead to suicide. Estimates are that 80% of the people who commit suicide are profoundly depressed. While suicide rates overall are decreasing in the Western Hemisphere, disturbing indications are that suicide in younger populations is increasing. Increased use of drugs among youth may be causing the suicides. And we can talk about drugs. I mean, you can talk about kids drinking alcohol, you can talk about kids smoking pot. And while they're drunk or while they are stoned, they're probably okay. Alcohol, both alcohol and marijuana, make you raise your level of feeling good. It increases your serotonin level, makes you feel pretty good. The problem is when they're not drunk and when they're not stoned. Because they have artificially stimulated their happiness, the level of happiness that they feel, because they've artificially stimulated it, they have what we refer to as upregulation of serotonin receptor sites. They have a downregulation of serotonin receptor sites, and this is because The brain doesn't want to get overstimulated with happiness or with sadness, for that matter, but it wants to be normal. The problem is that if you overstimulate something or superficially stimulate something with ecstasy or with marijuana or with alcohol, if you overstimulate it, then your neurons will downregulate. They will try to protect themselves by having fewer receptor sites. Now this is okay as long as you're using your medication, your alcohol, your marijuana, or your ecstasy, but what happens when you go off of it? What happens when you go off of it is that because you've downregulated your neurons, now you have fewer receptor sites. So if you've ever been around an alcoholic or you've ever been around somebody that smokes pot and is not stoned, a lot of times they are grouchy. They're really, really, really grouchy when they're not using. And for this reason, of course, depression is very common. And this may have something to do with the increased level of suicide in kids. As adults, of course, we are smart enough to figure this out. But of course, or we are smart enough to stay drunk all the time or stay stoned all the time. But as children, of course, adolescents who are just trying to rebel, of course, they don't have that form of logic. Their brain isn't mature enough to figure this out yet. So they have a problem, and potentially that's what may happen to them. Looking at concordant studies, the incidence of depression is much higher among dizygotic as monozygotic twins. Concordant studies of monozygotic twins raised apart shows equally similar results. So there's probably some genetic aspect to it. As I said, it's on the same gene as schizophrenia, ADHD, bipolar disorder, and autism. These studies point to a strong heritability of depression. And of course, if you wander around and talk to different families, you'll see families that some families are pretty upbeat and some families are depressed. My wife comes from a family of depressed people. Her mother was clinically depressed and was taking medication for an extended length of time. I have an extra chair for some reason. Anyway, she was taking medication, and her daughter, one of her daughters, and her son suffered from that. My wife doesn't, and it's probably because my wife fights to not be unhappy. My wife's niece has a problem with depression. She's been diagnosed with bipolar disorder, but she has a problem with depression. So one of them does and one of them doesn't. She has 3 children, and one daughter is clinically depressed. Depression is common in select medical conditions, especially those that involve the endocrine system and the brain and brain disorders. Cushing's syndrome is caused by a lesion on the pituitary gland that causes an excess amount of ACTH. And because of that, of course, you develop, the more ACTH you produce, the more cortisol is splashing through your system. The first symptom is depression of somebody with Cushing disease. Of course, it could be Cushing disease, it could be just normal depression. But if somebody is depressed, one of the things that we do is we test the individual for Cushing's disease. They become depressed, and then they become obese, and oddly enough, Cushing disease causes you to grow lots and lots of hair, which is really kind of strange. It grows in very odd places, like inside your ear. That's a sign of Cushing's disease. It'll grow right on the knob of your vertebra on your back. It's really kind of bizarre. Anyway, you grow a lot of strange hair in strange places. Parkinson's disease, 50% of the people who suffer from Parkinson's disease also suffer from depression that can be attributed to no other symptom. There's a commercial on television about this, and they want you to take a special medication. not only do you become depressed, but you also start seeing things, hallucinations. You have hallucinations and delusions, which is kind of scary, I guess. This may be due to lower levels of serotonin from loss of neurons in the dorsal raphe nucleus, where large amounts of serotonin are stored, and because of this, of course, that causes the individual to be depressed, but only in about 50% of the cases of Parkinson's disease. Respirine, a drug that increases monoamine oxidase and thus depletes serotonin and norepinephrine, causes profound depression. Some researchers have looked, let's give somebody a drug that makes them profoundly depressed. Respirine is an antipsychotic. Some researchers have looked at these effects and point to increases in monoamine oxidase as the cause of depression. Electroconvulsive therapy works, and the reason it reduces your depression is because it reduces biogenic amines, it burns them, and actually it cooks them, and that makes people less depressed. All around the world, more women than men suffer from depression at a rate at near 2 to 1. Several interesting studies show that rates may actually be closer to the same for men and women. In other words, men and women have the same level of depression, but men self-medicate more. They were looking at depression rates among the Amish, and what they found was that men and women are depressed at about the same rate. So what in the world is the intervening variable? Why do Amish men, why do they have the same level of depression as their women do? Amish men do not drink alcohol. And because they don't drink alcohol, of course, they don't self-medicate. So the reality may be that a lot of people who are drinkers, who are alcoholics, a lot of these individuals are suffering from depression. And that's why they drink. It's a form of self-medication. And because of this, it's really difficult to treat. Alcoholism, mainly because sometimes they're self-medicating, and of course, they don't want to stop because they don't want to be depressed. So when you cure them of their alcoholism, a lot of times they'll drift into depression instead. And of course, then you need to treat the depression. So if you were treating the alcoholism or the depression, which would you treat first? Potentially, if you treated the depression first, then you could get them to stop drinking fairly readily. If you could get them to stop or not have depression. So if you gave them a select, of course, if you're taking an SSRI, you're not supposed to drink. It can cause all kinds of interesting problems, but we would need to treat them for depression first, and then we could treat their alcoholism. Sleep studies of depressed patients shows that people suffering from depression spend more time in stages 1 and 2 and much less time in more restful stages of 3 and 4. Now in stages 1 and 2, if you've ever fallen asleep in class, sometimes you're awake and then all of a sudden you're having this amazing dream. That's stage 1 or 2. 1 of course is relaxation, and 2 is the first stage of sleep. Because of this, of course, these individuals are having these fantastic dreams. They're not getting enough rest, and because they're not getting enough rest, they're not repairing their bodies. They don't go into stage 3 and 4, and so they got a problem. They got a really serious problem. This means that depressed people jump into REM episodes much earlier than people with normal sleep patterns, and of course, that's another form of depression as well, or that's another form of dreaming as well when you jump into REM. REM sleep seems more intense for the depressed. And one of the interesting things, if you talk to depressed people and ask them about their dreams, they'll tell you that they have more intense dreams. Well, sure, they have more intense dreams. They're having dreams in the 1 and 2 state where they're just starting to fall asleep, and then in REM where you have more fantastic dreams. And so they will have dreams that feel more intense to them than individuals who have a normal sleep pattern. Studies show that the shorter the time that it takes to go into REM, the more severe the depression. which means they're not going into 3 and 4 at all, so there's very little repair taking place. One of the effects of antidepressant monoamine oxidase inhibitors is the fact that it reduces REM sleep, and that may be one of the reasons why it works. Monoamine oxidase inhibitors. Research by Ontiveros and his colleagues found that 40% of the people they tested had abnormalities in their temporal lobes. Even in the resting state, these individuals have increased activity in the hippocampal area, an area known to induce fear when stimulated. The most common treatment of anxiety is the pharmaceutical benzodiazepine. The benzodiazepines such as diazepam and Xanax. But benzodiazepines work because they change the permeability of neural membranes to chloride ions, especially those that react to GABA. If we can increase your GABA level in your brain, then you will be less afraid. The influx of chloride ions inhibits the firing of the neuron, and because of that, of course, we have less fear. So what we need to do, why the benzodiazepines work, is because they increase the amount of GABA that is able to get through the neuron. And it's an inhibitory neurotransmitter, therefore it makes it less likely that you will be afraid because of the GABA. Studies of individuals suffering from PTSD have shown that on the average their right hippocampuses are 8% smaller than people without PTSD. High levels of circulating glucocorticoids from the chronic and intense stress of the PTSD may have caused the cell loss in the hippocampus, and this is one of the things that we've seen with individuals who have suffered combat-related PTSD. Their hippocampuses are smaller than people who do not have PTSD. Research looking at OCD has found that sufferers have increased metabolic activity in the caudate nucleus, the left orbital gyrus, and the left anterior cingulate cortex, and bilateral orbital frontal cortex. Increased serotonin levels decrease OCD symptoms, especially the tricyclic clomipramine. The tricyclics are an older generation of antidepressant. As a matter of fact, they're one of the first monoamine oxidase inhibitors, and tricyclics were the first antidepressants that we discovered. Anyway, we can use clomipramine and we can treat OCD. The caudate nucleus, of course, is one of the major areas that causes the individual to be obsessive-compulsive. Tourette's syndrome is a tic disorder. These individuals seem to be unable to stop themselves from motor tics where they have to do things. They can't stop themselves from moving. Vocal tics where they will, pressure will build up until they have to blurt out something, or compulsive actions. It's like being obsessive-compulsive. The average age of onset of individuals with Tourette's syndrome is 6 to 7. These children may also have problems with ADHD and with OCD. So they have ritualized behavior. It's not like they're autistic because they can interact with other individuals. The problem is they have this compulsion to do things, whether it's a motor tic or a vocal tic. Sometimes it's yelling, and sometimes it's obscenities, oddly enough. They will yell obscenities because it builds up in their body and they just have to release it. There's a single gene that may cause the problem of Tourette's syndrome. Concordant rates of monozygotic twins is 53 to 77%. Indications are the dopamine receptor D2 are sensitive in these individuals, causing involuntary movements because they are seeking stimulation. And of course, if they're not getting outside stimulation, the D2 sites are it's building up until they have to dissipate the pressure that they feel, so they have these vocal tics, these physical motor tics, or other compulsive behaviors. Mad cow disease is bovine spongiform encephalopathy is what mad cow's disease is. For a while there, we weren't exactly sure if we would be able to control mad cow's disease. The problem was England. The English were taking all of their old cow body parts after they butchered a cow. They were taking all the parts that they didn't eat, and they were grinding them up and they're feeding them to other cows. And of course, as cattle feed. Well, unfortunately, some of these cows had bovine spongiform encephalopathy. And because they ate the brain and spinal cord tissue from infected cows, it infected them. So England had this really serious problem with mad cow's disease. It started in England. About 200 people died from eating cows that had mad cow's disease. They're eating the brains or eating the spinal column. Because of mad cow's disease now, of course, we don't eat cow's brains anymore. In the old days, of course, we would grind the brains up and make sausage out of it, or we would grind the spinal column up and make sausage out of it. We don't do that anymore. That portion of the cow is discarded. We used to eat cow's tongue. We don't do that anymore. It's very rare. I guess you can still find cow's tongue, but in the old days you used to be able to find cow's brains, and back in the 50s and 60s before mad cow's disease. Humans don't really. Okay, what happens with mad cow's disease is that they have a mutated protein in their brains called a prion. And because of the prion, any protein that it gets close to, it will force that protein to become a prion, as odd as that may seem. Anyway, that's what happens with mad cow's disease. We have a human form of mad cow's disease called Jacob-Creutzfeldt disease, which causes a really serious problem. Which causes the same problem. And we've seen an outbreak of Creutzfeldt-Jacob disease in the South Pacific. They had individuals who were headhunters. They would eat the brains of their, in New Guinea, they would eat the brains of their enemies to gain their knowledge, as interesting as that was. Anyway, these individuals with the problem would develop Creutzfeldt-Jacob disease, or Jacob-Creutzfeldt disease. I can't remember which word comes first. Okay, those of you watching this movie, this is what, chapter 16. I'm going to go through the quiz. If you watch this thing all the way to the end, then you will get all the answers to the quiz. Epidemiological studies reveal that the incidence of schizophrenia among the world's population is blank, and this disease appears to have been present since the when? And the answer is B, of course. It's 1 to 2% beginning of recorded history is the right answer. An example of a positive symptom would be blank, and an example of a negative symptom would be, this is schizophrenia that we're talking about here. If you remember, a positive symptom is something added, and a negative symptom is something taken away. So hallucination is an addition, but a delusion is also an addition. Motor excitement would be an addition. Hallucination is also a positive symptom. Hallucinations, of course, is a positive symptom. Emotional and social withdrawal would be a negative symptom. The answer is C. Blunted affect, of course, this is a negative symptom, and that's a positive symptom. So the answer is C. Hallucination, something added, hallucinations were added, and emotional and social withdrawal, of course, is something taken away. So the answer is C to number 2. Number 3, MRI studies of identical twins who are discordant for schizophrenia In other words, only one twin has the disease, have revealed that the affected twin often exhibits an enlarged, and the answer, of course, is lateral ventricle. D is the answer. As we learned, we saw that that MRI of the two brains. That was actually a CAT scan of the two brains, and we saw that the individual with the twin with schizophrenia had a much larger ventricle than the twin that didn't have schizophrenia. Number 4, in people with schizophrenia, cellular abnormalities are evident in several limbic system structures, including the amygdala, hippocampus, and the parahippocampal gyrus. In these regions, what's going on in these regions? The answer is A, the pyramidal cells appear disorganized with individuals suffering from schizophrenia. If you remember, we saw those disorganized cells. Number 5, amphetamine abusers may take much larger doses. The use of very high doses may produce amphetamine psychosis is the answer. May cause psychosis. Chlorpromazine belongs to the class of antipsychotic drugs known as phenothiazines. This is the answer. Antipsychotics in general are known as neuroleptics. Phenothiazines, chlorpromazine is phenothiazine. Number 7, patients with Parkinson's disease, given L-DOPA, secrete increased amounts of dopamine and may experience blank. Conversely, when people with schizophrenia are treated with dopamine antagonists, they may develop symptoms resembling blank. So patients that are given L-DOPA, they may have psychotic side effects. And if they give them too much dopamine antagonist, it will give them Parkinson's disease. It will give them symptoms resembling Parkinson's disease. So the answer is D for number 7. Number 8, the long-term motor problem associated with the use of many antipsychotic drugs is called, and of course this wasn't in the chapter, but I do know the answer. The answer is A, tardive dyskinesia. Of course, the rest of these don't have anything to do with movement. Tardive dyskinesia is the answer to number 8. Number 9, unipolar major depression occurs most frequently in people blank, is most common in blank, and tends to last for months. If untreated, at any given time it is estimated that up to 20% of the population is suffering from depression. Unipolar major depression occurs most frequently in people over 40 and is more common in women. So C is the answer to number 9. Number 10, in the 1930s, electroconvulsive shock therapy, in which electrodes deliver electricity through the skull to the brain, has been used unsuccessfully to treat schizophrenia and successfully to treat, and the answer is severe depression. Remember, it burns up amines, and that lessens their symptoms. Number 11, people who attempt suicide tend to have low levels of blank or its metabolites in their CSF. People who attempt suicide tend to have lower levels of serotonin. They are depressed, and 80% is the figure that we gave. Number 12, one important biological effect of light is that it suppresses the hormone suppresses the hormone melatonin. Light suppresses melatonin. That's how you know when you're sleepy. Number 13, in seasonal affective disorder, people tend to be depressed in the spring with rain, and the fall with dust from the harvest, in the winter months due to bright sun. Summer, in the summer, the answer is C, of course, in the winter months. Bipolar illness is treated with the metal lithium carbonate. And that's how we treat bipolar disorder with lithium carbonate. Number 15, anti-anxiety medications are known by the general name blank. Nowadays, the most prevalent class of anti-anxiety drugs consists of blank. Anxiolytics and anti-anxiety medications are known by the general name anxiolytics. And of course, the most prevalent class of anti-anxiety drugs consist of benzodiazepines like diazepam. So the answer is C. Number 16, the benzodiazepines interact with reactors for the transmitter blank, potentiating the ability of this transmitter to produce an inhibitory postsynaptic signal through the modulation of chloride conductance. These receptors are distributed widely throughout the brain, but they are especially dense in the cortex, hippocampus, and the blank, which is especially implicated in fear. The benzodiazepines interact with receptors for the transmitter GABA, and the area is the amygdala. The answer is A, fear. In PTSD, high circulating levels of blank may lead to cell loss in the blank and may contribute to memory abnormalities. When we are excited, of course, cortisol is produced, and of course, memory loss has to do with the hippocampus. So the answer is D. Number 18A and blank is an act that an individual performs over and over without reason for the ability to stop, such as excessive hand washing, counting rituals, hoarding, or checking of kitchen appliances. A and blank is a recurrent, unshakable thought that intrudes into the consciousness over and over. Subjects include such concerns as fear of germs, lucky or unlucky numbers, orderliness, or fear that something terrible will happen. The answer is, this has to do with obsessions and compulsions. Compulsions are the acts and obsessions are the ideas. So an act is a compulsion, and an obsession is the idea. So unshakable thought. So A is the right answer. I hope. 19, blank is particularly effective in treating OCD. And important aspect of this action is that its ability to block the reuptake of blank. Some of the symptoms of OCD, such as failure to suppress adrenocorticoids after dexamethasone administration, have caused some researchers to argue that OCD may be related to depression. So blank is particularly effective in treating OCD. As we learned, it was clomipramine, which is a tricyclic, and of course it blocks the reuptake of serotonin, leaving more serotonin in the synaptic cleft, so that you can feel better because you have more serotonin. So D is the right answer to number 19. Number 20, the causative agent in mad cow's disease, properly called bovine spongiform encephalopathy, or BSE, is an accumulation of abnormal folded proteins called prions. Humans contract the disease called Creutzfeldt-Jakob disease when they eat beef from infected cattle. Emery, hello, how are you?
I'm well, sir.
Good. What time is it? It's almost time, isn't it? So B is the correct answer to number 20. And that's it. I just gave you all the answers. You're lucky. See, I'm nice to my students. Not very many of them, but sometimes. It happens.
How was your vacation?
It was okay. I had a good time.